Today I'm going to talk about this one ingredient which you should never use if you have psoriasis, eczema, dermatitis or most skin diseases which are chronic. You have it since years and years, get relief, comes back again, which has now become resistant to all the other treatments, a disease for which you have been told there is no cure, it is incurable. In over 46 plus countries, when we happen to speak to patients, they tell us that they wasted their 5 to 7 years time on an average. In 10,000 patients, on an average 5 to 7 years to realize what they've been doing all these years and what they actually should have done. This video is to educate you about the overall process of lifelong recovery. Why you shouldn't use this ingredient, what it really does, what are the things that you think of for several years, and what is the reality. Watch this video till the end. Be very careful, be very mindful while you watch this, and we're going to discuss about this ingredient and how Ayurveda cures the root cause of skin diseases. Namaste everyone, welcome to Jyovis Hospital of Ayurveda and Aesthetic Center, Mumbai. In over 60% plus cases, we see a skin disease initially starts from the scalp, either in the form of dandruff or mild itching. We have a video on YouTube, how to cure scalp infection. Do watch it, link is in the description. I've explained in detail about it. So mild itching, dandruff, we use some quick fix antifungal shampoos, we suppress it, and the problem is anyway existing, but few months later, few years later, we see the first patch over our body. So we see the first patch and we use several different creams. To be honest, all these creams have the same ingredient, but we have a habit of not seeing the ingredient but to see the brand name. In an example of fever, you are talking about crocin, I am talking about Dolo 650. Dolo or crocin both are same because it is paracetamol. It is 500, 650. It is one and the same. So patients use several creams. This one ingredient is present in 90% plus creams or 90% plus treatments. Patient sees that as it is applied, it is gone. Another patch comes, gone. Another patch comes, it is gone. The patients feel that it is the nature of the disease to progress further. Patients take at least 5 years on average to realize that it is not just the nature of the disease that is progressive, that's true, but it is also the nature of this medicine, this ingredient that further progresses the skin disease. You press a spring, remove the pressure, it has to bounce back. Any emotion, anger, anything that you suppress, it has to bounce back. And this is how we see from 5% of skin disease after the recovery, 6%, 7%, 8%, either the patches multiply or either the intensity of the symptoms multiply, the itching, redness, swelling, burning, watery discharge, blood discharge, all of these progresses further. So nature of the disease progressive, but also the cream or the medicine ingredient which is also progressive. Let's understand about this ingredient. It is clobetasol or halbetasol. It is a class of medications called as the corticosteroids. It is no doubt, I don't deny, a life savior. It is a life savior. It is a very beautiful, amazing medicine. It is having great results for redness, itching, swelling, burning. It instantly gives results to the patients. It is said that within 2 weeks of time of using this particular medicine, the patches disappear, and that is true. But in your case, if you have a disease which is chronic, reoccurring, multiple failures are there, even if you use it for lifelong, it is not going to cure the disease. Of course, in 5 to 10% of the cases we see within a month's time, patients have recovered, they are free. In 2-3 months, they have the disease, they use this medicine, they are free. But for a person who has had it since a year, 5 years, 10 years, and then they use the same ingredient of another brand and they see that the disease is gone, this is not a really seen. So very important is to understand that these are autoimmune conditions. Here the immune system is attacking the skin like a virus. Very important to make the immune system friendlier with the skin. So the entire treatment should be for the immune system to make it friendlier, with the skin, so it doesn't attack the skin like a virus. If you suppress any problem, it has to bounce back, and we've seen cases from 1 year to 40, 45 years of the same cream applied on and on. We see this on a daily basis since last many years. It is the same story in 80% plus cases. Hence, I thought of making this video to educate you about the overall process of what you have been doing and what you should be doing for that lifelong cure. Of course, 5%, 5%, 10%, 15%, that's how we go through Ayurveda. We recover all the damages, all the problems, and the patients get lifelong results. So in case you've been using this ingredient, now you know what you should be doing. On this channel, Jyovis Hospital of Ayurveda, we have several videos and information on herbs, diet, home remedies, and several different aspects where patients have seen results from the first 1.5 month itself. So choose Ayurveda, choose wisely, be positive, don't be stressed or depressed about the skin disease that you have. There is always a cure in Ayurveda, whether it's about dermatology, orthopedic, gynec, psychiatry, or neurology. Where the world says there is no cure, Ayurveda has a cure. It is proven with all data in front of you, with all the information before, after, everything, be it any disease that you know which is incurable. So this is all about Ayurveda. Choose it, choose wisely. Any doubts, any questions, let us know in the comment section below. This is Dr. Raj Satpute from Jyovis. Until next time, look impressive, be progressive.